They steered us through the COVID-19 pandemic, which is no longer a global emergency. Now, refocused attention on building out Jamaica's public health infrastructure, increasing access to care and quality of service.
This year, the ministry has provided a capital budget of $6.43 billion, 31% increase in what has been provided for financial year 2022-23. We have more money to spend on our capital budget.
The build-out of the new 250-bed Western Children and Adolescent Hospital moves apace this year.
Western Child and Adolescent Hospital is now on its 5th floor. It's building, it's going up. That is work in progress, Madam Speaker. We have spent through the grant from the Chinese government, some $450 million, and we are slated for completion in 2025.
The third and final phase of the Cornwall Regional Hospital's rehabilitation work to create a new state-of-the-art health infrastructure commences this year, with completion set for 2024.
There's a $14 billion expenditure associated with that, and that means the internals, and we expect that we will begin to reoccupy the main building by the end of this year.
Other capital projects include the start of construction for the new Spanish Town Hospital, which will see $6.4 billion in expenditure over 2 years.
This state-of-the-art 7-story, 100-bed facility will boast 7 operating theaters, a new accident and emergency center, a new pharmacy, several other support services including lab and other diagnostic services. Under these investments, the Spanish Town Hospital will see services expanded in cardiology, oncology, hematology, ophthalmology, and ENT, Madam Speaker.
$300 million has been allocated for work to reroute the ring road at the University Hospital of the West Indies and clearing construction site for a new 6-story medical facility projected to cost $30 million.
When you summarize the expenditure, you're talking about 27 billion Jamaican dollars, or US 178 million. Cornwall Regional, 14 billion left to be spent. Western Children Adolescent, 5 billion left to be spent. Spanish Town, 7 billion to be spent. UHWI, 3 billion to be spent.
In addition to these, significant infrastructure work is also progressing at 10 health centers, which are being built or renovated under an IDB and EU-funded project. The regional health authorities, National Health Fund and Chase Fund are also carrying out projects to expand Jamaica's health infrastructure in the 2023-2024 fiscal year and beyond. There is a mission to modernize public health in Jamaica. It includes a $754 million contract for a digital integrated health information system to facilitate telehealth and telemedicine.
This year, we'll continue the implementation of 15 health centers and the full rollout of electronic health record system in these facilities by early 2024.
Digitization of the health system is also continuing in another 105 health centers. A $1.26 billion contract was signed earlier this year with Cable & Wireless to provide ICT tools for the initiative.
It means, Madam Speaker, shorter transaction time, so less wait, because patient files are not kept in a hard copy file somewhere that sometimes can't be found. It means telemedicine, serving remote areas over long distances where specialists are not available. Madam Speaker, we are creating a modern digital health system.
The Health Ministry's Code Care program will continue and seek to do another 1,000 surgeries this fiscal year through public-private partnerships. It also includes the procurement of equipment and supplies, as well as repairs to vital infrastructure.
We are working to repair operating theaters in our public system, 15 operating theaters at a cost of some $750 million, which has been allocated, Madam Speaker.
To provide life-saving diagnostic services, the Health Ministry will augment the outsourcing method for CT scans, MRIs, and X-rays with some purchases.
The Ministry has launched a tender process for the leasing of over 49 pieces of equipment to include MRI machines, CT machines, and ultrasound machines. The tender will require the management and maintenance under a capital lease agreement for 9 CT scan machines, 4 MRI machines, as well as 36 fixed and mobile ultrasound machines.
In a major move to improve service delivery and support primary healthcare reform, the ministry is taking steps to establish an additional 2,000 permanent posts for doctors in public health over the next year.
What that means: less patient to doctor ratio, more specialists in the system, more doctors at the primary community health care, including and also in the hospitals. When we have more doctors, Madam Speaker, it means that patients will get better care.
Customer care services across public health will be improved with upgraded waiting areas and sanitary facilities in 9 hospitals and health centers, plus increased trained customer service personnel under the revised Compassionate Care Program. Too many Jamaicans are dying young, and the number one culprit is a confluence of non-communicable or lifestyle diseases. The Ministry of Health and Wellness is taking aim at the problem in fiscal year 2023-2024. A healthy lifestyle initiative dubbed #KnowYourNumbers will have more Jamaicans doing screenings to know the numbers for their blood pressure, blood sugar, and body mass index, among others.
It's about getting Jamaicans to screen at least once each year to know their health status and what they need to do to modify their behavior to reduce illness and premature mortality. Our target is to do 500,000 screening tests done this year, 2023-24.
Other interventions include a $50 million prosthetic partnership program with the Jamaica Council for Persons with Disabilities. It will provide prosthetic limbs to persons 60 years and younger who are in need to reintegrate into productive activities. A $60 million program will be introduced to provide 10,000 Jamaicans with replacement dentures. The good oral hygiene intervention in schools will also continue. There is also the return of the Cuba Eye Care program. The ministry will also explore and intensify other eye care initiatives, including eye screening for students in 50 schools. Mental health response will be enhanced through expanded community-based interventions and the Do Your Share campaign going to 50 additional schools. Also, a $150 million investment will be made at the Bellevue Hospital to create 2 distinct institutions, a mental health rehabilitation center and a 100-bed mental health hospital. All these are just some of a wide range of transformational work taking place within the Ministry of Health and Wellness for the 2023-2024 fiscal year.